trigger bands that I had treated. This was the guy that's driving over from the Tri-Cities to work with me. Those were very old. His comment after I did that to him was reaching and saying, I haven't been able to move like that since high school. He's in his 40s. So I saw that and was like, can I please get a picture? Also want to note all those branches and everything. So as you're tracing it, you might feel that it branches out. Some of that white stuff, when I was first going over that trigger band, I would see that white line ahead of my thumb. So I knew exactly where I was going to go. It was old. Patients can also tell when you get off of it most of the time. So the person I was doing it on today, especially because I was working on some breast tissue area, I went off of it a few times and she said the first time I went off of it, oh, you're not on it anymore. And I was like, exactly. So you know for sure that I'm actually tracing something, not getting frisky. So and she was like, oh my goodness, this is amazing. All right, the last two, tectonic fixations and cylinder distortions. Tectonic fixations. We've got all these layers of fascia and tissues that should be moving over each other, and if the fluid in between them is insufficient, then it gets stuck. So the picture book, my kind of book, it shows for tectonic fixations, a boat with water, that'll move well, and a boat without water, that's not going to move so well. It also shows like rusty gears and a bike. Those are pictorial descriptions of a tectonic fixation. Tectonic fixation, here's how they'll show it. I don't know, somewhere in there, I don't know. So similar to a fold, they're very similar to a fold in my mind, but slightly different as far as what fascial distortion is going on. Treatment will oftentimes be very similar. So with a tectonic fixation, you can do the high velocity thrust, same as a fold, a little bit of a different vector just because of the difference of what's going on, or you can do a milking technique. Tectonic fixation and that understanding radically changed how I treat adhesive capsulitis. So my NIOMT training would say you mobilize the heck out of it and the patient hates it and it sucks. FDM model says it's tissues that are stuck together because there's no fluid, so you're going to milk it. And so I'm staying in a relatively pain-free range, typically totally pain-free range, and milking it, and it's annoying as all get out. Dr. Capistrant, who's one of the main founders of the American Fascial Distortion model, he has students do it. Student, you're going to do this for 15 minutes. Hope you ate your Wheaties. And they'll do that in massive changes. In one of the classes that I was at, we had a person who demonstrated like this much range of motion. The instructor did the milking technique for like 5 minutes and she gained an obscene amount of range of motion. It was nuts. So, tectonic fixation, how are they going to show it? I don't know. Somewhere in there. They might do this kind of a thing. They might describe low on oil, sense that something needs to pop or crack, and they're going to have reduced range of motion. Just like that boat isn't going anywhere, their shoulder isn't going anywhere. Cylinder distortions. We've got cylindrical fascia in the body as well. My demonstration of a cylinder distortion is that. So we've got this now tangled, jumbled coils of fascia. That's going to also impact your range of motion. People will describe it as bizarre. I have this bizarre pain. It jumps around. The symptoms might be oddly disproportionate. And so a small stimulus causes obscene levels of pain and dysfunction. Could it be malingering? Maybe. Maybe it's a cylinder distortion. Maybe you clear the cylinder distortion and now this malingering patient has no pain. Guess who they're going to send all their friends to? Yay. It can feel swollen and not look swollen. So if a person's like, it just feels, also notice what I'm doing with my hand, it just feels swollen in there and you're looking at it and you're like, I don't see it. Cylinder distortion, that tangled fascia, so it's throwing off their ability to tell. They'll oftentimes talk about it being deep. They'll have paresthesias. They might have tremors, fasciculations, cramping, etc., all that sort of stuff. I'm thinking, okay, what's going on with the cylinder fascia there? And pain with active range of motion and not passive. So they go, that hurts. I lay them down and I move it, no pain. There might be a cylinder in there. Again, cylinders are thinking cylindrical fascia that's all crumpled up. They are fun to treat, sort of. You get to play with toys. A vice can be some of it. Acupressure rings. My wife does not have cylinder distortion, so I have her do this or use an acupressure mat. I don't know if you guys have seen acupressure mats. I have one in my car and one here I should have pulled out. a person with a cylinder distortion goes, oh my goodness, that feels amazing. I've had people threaten to steal these if I didn't give or sell them to them. And then you have someone like my wife who doesn't have cylinders do it. She's like, that's weird, I don't like it. So cylinders, oftentimes people really appreciate it. You can also do some cupping. And the idea is you're trying to help that fascia to unravel itself. I showed sheep and 4-H growing up. And so I think of like combing out sheep wool. So all those needles, and that's what I think of when I use the acupressure mat, which is a pokey mat is what I call it. Questions with cylinders. Again, they're going to be bizarre, disproportionate, not make sense, often mistaken as malingering in the traditional mindset that ignores fascia. Any questions with tectonic fixations? All right, we're going to go a little bit long. We got 2 minutes left, but let's break into groups and talk about tectonic